GLP-1 weight loss drugs like Ozempic and Wegovy have taken the medical world by storm, being used for weight loss in patients for whom there's an FDA indication and for many who don't have an approved indication. And they're used because they work, right? Let's be honest, they work incredibly well for weight loss. But could they also increase the risk for suicidal thoughts and suicide attempts? That's obviously a critical question to answer, and a new study suggests that Semaglutide, the generic name for Wegovy and Ozempic, might increase the risk for individuals who are also taking antidepressants. It's not strong data, but is it enough of a concern? Let's get into the details. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Now, before we get started, this video is about the risk of suicidal thoughts and attempts. So if this is triggering for you, please take care watching this video. Also, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision. Consult your healthcare provider before changing your lifestyle or medications. In addition, please recognize that people may respond differently to ketosis, and there isn't one universal response. So we did a video last year when the European Medicines Agency, the EMA, reviewed the risk of suicidal thoughts and attempts with these GLP-1 weight loss drugs. There wasn't much data at the time, but there were enough reports, enough of a signal to warrant an investigation. And remember, the original trials that helped Semaglutide get approval for weight loss excluded anyone with a psychiatric diagnosis or a history of suicidal thoughts. So there isn't much data at all on this topic. But it's clearly a moving target, as GLP-1s have been used for, a decade or more in low doses for type 2 diabetes. But over the past 2 years, they're being used in much higher doses in over 20 million people for weight loss, with or without type 2 diabetes. And here's what makes this subject so difficult. There are published case reports, as well as clinical and individual experience, suggesting that GLP-1s may help with depression or may help with overall mental health. And there are reports of the opposite. So which is it? Does it help or does it hurt? Well, there's likely the potential for both. So the question is, how do we know who's at risk for worsening depression and suicidality with these medications? Well, a new study examined post-marketing data from the World Health Organization and ran what's called a disproportionality analysis, which is essentially a method to see if an adverse effect is more likely when someone's taking a specific medication. And what they found is, frankly, pretty concerning. They found an increased risk for suicidality for those taking Semaglutide, Wegovy, and Ozempic, but not Liraglutide, interestingly, which is the name for Victoza and Saxenda, which are the lower doses versions of GLP-1s just for type 2 diabetes. But importantly, the findings were more likely for those taking antidepressants. Now, statistically, the increased risk is so small. It's a small risk in an absolute sense. And a study like this doesn't prove causation, but obviously the magnitude of the risk from the behavior, suicide, is monumental, so something to be taken very seriously. And this is likely just the beginning of all this data coming in, so many more studies will undoubtedly follow, but it raises the question, what should we, the royal we, individuals and healthcare practitioners, what do we do with this information now? Should people with a history of depression or people taking antidepressants just completely avoid GLP-1s? Or is there a safer but still effective alternative to explore in these individuals? So, these are challenging questions when it comes to medicine. There's a widely popular drug with a potential benefit, but it also sort of this ill-defined potential for severe harm. So in situations like this, I like to fall back on the medical oath, first do no harm. That's vitally important here. And when you think about first do no harm, you think about alternatives. So I would suggest that alternatives exist. Ketogenic therapy could be considered a safe and effective alternative for treating overweight and obesity in someone with depression. You can look at studies from Virta Health and others which have demonstrated dramatic and sustainable weight loss, metabolic health improvements, and mood benefits with ketogenic therapy. And other studies, like from Dr. Sethi and others, have demonstrated safety and efficacy in mixed psychiatric populations, including depression and bipolar disorder and schizophrenia. Now, unfortunately, we do live in a sort of this drug-first medical society where the quick fix is often felt to be the best choice. But given the concerns with GLP-1 medications in patients with depression, the quick fix can also be the quick harm. And it's a prime example of how doing the work with lifestyle changes, entering and sustaining the physiologic state of ketosis, and working with an experienced healthcare provider may not be the quickest path, but it may be the safest and most effective path. But let us know what you think. Should we be using GLP-1s in this setting? Should there be a black box warning? We'd love to hear your thoughts. And as always, thank you for watching. If this was helpful, please like and subscribe, and please share our content with others who may benefit from it. I'm Dr. Brett Scher, and we'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.